So good morning, good afternoon, everyone. Welcome to this third edition of the webinar series in East Africa. My name is Victor Ndusi. I'm a consulting research fellow at the Health Effects Institute. I'm based in Nairobi, Kenya. So today's session is quite exciting and interesting. But before we begin, I would like to make some few housekeeping announcements. As always, we have chat open, and we do encourage you all to sort of send your questions into the Q&A function. Closed captioning is also available to you. And the webinar and the slides and the recording of this webinar will be made available at the link, which is the webinar website on our HEI website. We are available on all social media platforms, so do feel free to connect with us there. So today we are going to discuss communication. We've had a series of discussions on this topic. But before we go there, maybe a few words about the Health Effects Institute. We are an independent research institute based in the US with a lot of studies published on the health effects of air pollution, about 350 of them. More specifically, our work in East Africa is very young and has just started. And what you see on the photo in the middle is an interactive literature database showing some of the published works and published studies across the region. We do scientific review as well. We have, in the last year or two, released a global systematic review of traffic-related air pollution, or TRAP, if you like. In our global health work, we do engage across regions in India, Southeast Asia, East Africa, Kenya, and Uganda, and other countries as well, and Southeast Europe as well. And on the far right, you'll see some of our products through the State of Global Air Initiative, with a recent report focusing on Africa that's available both in English and French. So that's a bit about HEI. And we are here today specifically because of the work in East Africa. And as I was saying, this is the third in a series of 4 webinars. We started in September, and we had a discussion on data, what kind of data is available, both on the health side and the air quality side, what can be done, what is being done with this data. Recently in October, we had a follow-up discussion on strengthening capacity for locally led research. And we saw a few examples from, groups that are doing just that in the region, of course, in collaboration with parties outside of the continent. So today we have another edition of this discussion, which is more to do with the communication, expanding public engagement and communication on air quality and health. We have, many communities who are discussing these topics and maybe do not understand, aspects of, the technical languages that we use, PM 2.5, particulate matter, et cetera, et cetera. So how do we get that message across to those who need it the most? In most cases, the public. So our agenda for today, we have a 2-hour session. We're going to start with some perspectives on the health effects of air pollution, and we're going to listen from colleagues from C40 and Vital Strategies, who will give both, the health perspective and, the kind of work they've been doing in the case of Vital Strategies and the work they've been doing across the continent in terms of communicating air pollution and health data. We'll hear from 2 more colleagues with practical examples of what's being done at city level with the city of Lagos, and what's being done in the example of Nairobi to communicate this message to journalists who really are able to get to the masses and explain some of these technical things that we discuss very often. Hopefully we'll have some time for discussion and to engage the audience. That we do encourage you still to send in your questions. We may take a few questions from the floor, maybe 1 or 2 hands, and really go into deeper into what communication entails in the context of air quality and health. So to take us through this session, I will be the moderator for the session. We have 4 speakers who will be taking us through some of the things we just saw on the agenda. And we will start with Dr. Victor Ndasi. So I'll stop sharing my screen and introduce Victor so that he can get us started as I shuffle my screens here. So Victor Indasi is not very new to most of us in East Africa. He's the program manager, Africa Cities for Clean Air at C40 Cities. He's responsible for managing the program's work in 13 African countries. He works closely at C40 with, the region's team and the Global Air Quality Program and other partners to evaluate the landscape of air quality activities in the C40 cities. I think you can already see the 13 cities that we talked about there. He also works to identify the barriers, the city needs, priorities, and contributes to the ongoing development of C40's air quality strategy across the region in Africa. So without further ado, Victor, welcome. The floor is yours.
Thank you so much, my namesake. I hope my screen is visible and I'm audible.
Yes, we can see the screen and we can hear you.
Okay, thank you so much. And sorry for joining in late. In fact, I was coming from a doctor's appointment. I'd asked my colleague to fill in, so sincere apologies to Tibebu, who had prepared to take you through this particular presentation. But I'll do, and then if you have any questions, please drop them on chat. We are a big team here. I have my colleagues Simon, Seneca, and Tibebu on call, and they can be answering any questions that will come up. So the way we prepared for this presentation, Victor, is that we wanted to give kind of a highlight of how we go about communicating air quality, and specifically speak to a workshop that we recently had early this month in Addis Ababa, bringing together all the cities you're seeing on screen in green in Addis Ababa. And then from there, I think we can go into specifics where our team in Lagos, also on the call and will be presenting, can go into details of how they take this one up and then replicate this in terms of tangible communication strategies at city level. So those who don't know C40, it's a network of mayors from metropolis or mega cities around the world, almost 100 of them. And we directly represent almost more than 500 million people around the globe. In Africa, we active in slightly more than 13 countries, but as a program, we are active in 11 of those 13 countries. So why are we here? Why are we even talking about air quality, and particularly air quality in cities? There are two reasons why we do that. Mainly is because in Africa, there's rapid urbanization. So most of our population live in urban centers, and with this rapid urbanization, obviously air quality becomes a big issue because of its close relationship with health. Second is because none of the cities in Africa do meet the WHO standard for PM2.5 exposure. They're making it both air pollution issue, but equally important a health issue. And lastly, there is growing need for air quality to improve. City population, city residents are aware of the adverse effects of air pollution. So because of that growing sensitization around the issue, it leaves us with no other option but to address that particular issue. So in Africa, C40 works with the cities to address air pollution. And the reason why we work in Africa is because in Africa alone, we have more than 1 million premature deaths. And if we don't address this, 200,000 more will be added to that by 2030. And if we don't do anything, then that could add 1 more million people to those premature deaths. As a program, we have a vision and agenda on how to help African cities or cities generally in the world tackle that. So the vision there obviously is to improve the air we breathe around the cities, obviously trying to help cities meet the WHO standard. And also we work through 3 pillars in addressing that. Obviously, data is a big issue in Africa, and so we work closely with partners and cities to ensure that we improve or rather enhance the air pollution monitoring network. There is direct technical assistance that we provide to cities to address pressing priority issues. And lastly is working through mayors to spur mayoral engagement at this, but more importantly, to help mayors take ambitious actions to tackle air quality. When mayors talk to each other, they inspire each other. So yeah, previous slide briefly talked about how we go about this. But obviously, we move from that political commitment level where mayors make commitments, and then we work with technical staff at cities to ensure that those commitments are met. And we do this by fostering peer-to-peer learning, like what we are doing right now, improving air quality, and lastly, the direct technical assistance that I talked about. So we work obviously through pillars, or maybe what you call work streams. So one of the work streams we work with is the air quality network. And basically these are a program that brings together cities so that they can share best practices and also inspire each other. And then there's the accelerator that speaks to ensuring that cities do commit. And in all our cities in Africa, they've committed to 2 particular commitments. Establish baseline levels. So we work with cities, including Nairobi, to do that. And I think in most cities, these baselines have already been set. And then number 2, implement new ambitious policies that help tackle air pollution in the cities. So once those policies have been set, or rather those ambitions and commitments have been set, programs like ours come in to help cities achieve those commitments. So our program here works around 4 pillars to ensure that we help cities achieve those ambitions, or rather those commitments that they have set for themselves. I'll not go through this because it's more repetitive of what I've already talked about. But I wanted to move closer to what we're discussing today, which is communication. So obviously you can't communicate what you don't know. And as a starting point at our program is try to help cities generate information that's relevant to their cities, information that speaks to their commitments, information that speaks to their policy requirements of the city. And you do this by, obviously there are various ways we do this, but obviously training cities on how to generate information using tools like our C40 Aqua tool, but there's also a tool like BenMap from US EPA. So we do run workshops like the one you're seeing on screen here, helping cities generate information. It's after generating this information that you can be able to communicate. So we've run a couple of webinars, but also training workshops just to train city officials to be able to generate air quality information that they can be able to communicate more. And when colleagues from Lagos speak, probably they speak more to that. So it's only after generating that information that we can now communicate. And we did notice that from our needs assessment that African cities do struggle to communicate air quality. And that's why we, early this month, we had the air quality communication training workshop in Addis Ababa, mainly to achieve 2 things. Enhance policy formulation, because it's only after you communicate the stakeholders are aware, policymakers are aware, and when they're aware, they can be able to implement policies that are evidence-based, but also policies that help address or help them achieve the commitments that they've already committed to. And then 2, increase knowledge among stakeholders, but mainly also spur city-to-city collaboration or city-to-city peer exchange. Because in Africa, as it is almost everywhere in the world, different cities have different ways of communicating, and cities can learn from each other on how to effectively communicate around air quality. This is usually a better way of doing this, other than the more traditional approach where cities try to reinvent these things. So the workshop in Addis Ababa help us achieve 4 outcomes. I'll not go to the details of those outcomes because of time, but I think when as colleagues from Lagos will be talking about how they're communicating air quality issues in Lagos, some of these outcomes will become evident in their presentation. And with that, thank you so much. Over back to you, Victor.
Thanks, Victor, for that wonderful presentation. Victor is not here alone. He's supported by his team in Africa. We have Tibebu, Seneca, Simon, who are here with us, so they'll be able to answer any questions that you all have. Feel free to also, introduce yourself in the chat and, say who you are and where you're from as we progress throughout this session. So thank you for that, Victor. So I will move on to our next speaker, who is Sami Simiyu. Dr. Sami Simiyu is a health sector engagement consultant at Vital Strategies. He's a dedicated public health specialist with over 10 years of experience in environmental health and air quality. He's made various contributions to improving, public health and population health, and has implemented effective public health programs on disease outbreak and pandemic response throughout the country. He's committed to bridging the gap between research and action, and he's striving to create a world where air quality is optimized for the well-being of all. He has a master's in public health and a BSc in environmental health, and he's overseen many multidisciplinary teams coordinating public health research for the government here in Kenya and, at county level, most recently at the Nairobi City County. So Sami, over to you. Would you like for me to share your slides, or you're okay? Sami, are you there?
Thank you, Victor. I'm trying to share can you kindly share? I'm having a difficulty sharing from my side.
Okay. Yeah, please proceed.
Thank you very much, Victor, and it's a pleasure being here. My colleague, Sumi, wanted to join. I hope she'll be able to join. If she is, if there is any question, she'll be more than willing to come in. So thank you so much. I think you can get the next slide. So I would just like to talk about our organization in terms of what we do. So for those who don't know Vital Strategies, we do focus on 3 areas, that is public health data, intelligence, we are on strategic communication and advocacy, and as well as institutional strengthening. So we do have work in different cities across the world, but for this particular, I'll be focusing more on the works that we are doing in Nairobi City, and as well as the other pilots that we are doing, 3 pilots at Jakarta in Indonesia, as well as Indo in India. So for this, we are focusing on 3 areas. We are supporting governments to basically identify the most important gaps, perceptions, and misinformations around air pollution. We are also supporting them to basically strengthen public health data systems and data use, just basically to inform policy. And lastly, we're just trying to support them to see, because you realize air quality is a cross-cutting issue, so we try to ensure that they mainstream the air quality on the ongoing public health efforts. Next. Next slide, please. My slide is not moving, Victor. Victor, my slide isn't moving. Next slide, please. Victor, my slide isn't moving. I don't know whether it's moving for the rest.
No, I don't see the next slide either.
Yeah, it's not moving. Maybe Victor, should I just proceed or you try as you try to sort?
Let me see.
Yeah, there you go. Thank you. So when it comes to communication, I think one of the areas that we've identified as a key area, considering that we as an organization, we are focusing on advocacy and communication, we realize this is very key, especially when it comes to enhancing public health awareness and education, especially advising people on which preventive measures to put in place, basically safeguarding the vulnerable populations by ensuring that they are aware and they understand the specific risks that are associated with the air pollution, especially in their context, just to know, fostering community engagement and advocacy, as well as promoting prevention and early intervention, especially with a focus on reducing the disease burden. And then lastly, collaboration, as I said, among different stakeholders, government agencies, non-profit organizations, academia, and all the other civil society organizations working in this space. Next. So basically, there are quite a number of air pollution. I mean, the effects, the impact cuts across all the life stages, as we know. So it's important to understand how to communicate this, because many times the community are not aware on at what point should they take precaution. So exposure to a pregnant mother as early as that early stages in life, it predisposes the unborn child to actually the fetus in the womb to the effects of air pollution, and it leads to reduction of course, reduced growth. As the child is born, we experience low-term births and low birth weights, and all the way to chronic and respiratory, of course, and cardiovascular diseases during adulthood. Next, please. So these are just some of the impacts in terms of, I just focused on Kenya, considering that you're looking at East Africa, and since you're working in Nairobi, just in terms of the impact. So in terms of deaths, the percentage of deaths that air pollution contributes to the deaths in the country. So if you look at COPD deaths, 46% of the total COPD deaths are actually attributed to air pollution. These are big numbers, so these are actually preventable deaths. So all the way you see respiratory, so many other conditions, respiratory infections, stroke, the lung cancers, as well as neonatal deaths. You can see the figures. So this is the impact in terms of what the air pollution contributes. Next. So again, we focus a lot in our experience as communicating. We realize that you tell people about deaths, but if you look at this, in terms of impact, deaths only contributes a very small proportion. So a few thousands, for instance, in the country, but we are not talking about the other impacts. So I think it's important to also focus on the other impacts, like the number of, kids who are not able to go to school, the working hours lost as a result of air pollution, the hospital visits and the admissions, as well as the cost implication that comes with this. So packaging this in that way places the community to be more aware and come up with informed decisions, as opposed to just thinking about that. And just from my experience, one time somebody told me, you'll die anyway. It doesn't matter the cost. So, and once you die, there is nothing you can do about it. So you cannot even talk about air pollution as a cause after death. So we need to look at the other impacts. Next. So this just to highlight about the approach in terms of higher service delivery in Nairobi. So the healthcare system here, of course, at the lowest level, we have the community, which is the level 1 service care provisions. And this falls under the preventive and promotive. And we have gatekeepers here who are the public health officers and technicians and the community health. So they are the ones who are supposed to do the messaging to the community at the household level. And then, of course, after this, we have the curative and the rehabilitative in different level of facilities ranging from level 2 to level 5 at the county level. But apart from this, we also have the level 6, which are not at the city level. So these are national facilities. So I focused on the city level facilities. Next. So basically, as an organization, we realize that for us to achieve this in terms of communication, understanding that this message needs to reach the target population, we focused on basically looking at the frontline workers, equipping them with key messages. And ideally, we need to, for improved air quality, of course, we need to have clean policies in place, regulations and emissions. Of course, emissions from multiple sources, looking at the different sources of emission to look at what contributes to air pollution. And to work on this, actually, we need to have in place public health interventions to ensure there is air quality. But if at all the air quality is already polluted, of course, we now look at ways in which we need to minimize the exposure of the population to the already polluted air in the environment. And once we do this, I think, again, at the end, we are looking at the health impact. So, and most of the times, traditionally, this is, just click on the next, Victor. Once we click on, or once a patient goes to the facility as a first contact when they are sick, and this is the time, actually, they realize we now work backwards. What is the cause of the, what is the cause of the disease? What is the cause of the disease at that particular time? So they work backwards as opposed to getting the messaging prior to, before they become sick. So I think focus on a clinical intervention is a bit limiting. So that is why our approach is more of public health harm reduction. Next. So in terms of the role the different, frontline workers play in the community and in the city at large, we looked at in terms of clinicians. Of course, they are very critical when it comes, because a patient will first of all go to the facility when they are sick. So they are actually, most of the times, the first contact with this patient. So the information they give at that point is very critical. But again, we realize time is limited in terms of the patient-doctor ratio in the country at large, so it becomes a bit of a challenge. They might not have adequate time to explain the causes, what causes the diseases and all that. So they manage the condition and the patient goes back home to the same exposures. So we realize beyond clinicians, for us, we focused on building capacity among public health and community health workers. And we trained in this year, in the month of March, April, that is, we trained community health officers and public health officers on communicating about health effects, to package their message and to ensure that it resonates at the right time. So that, because again, one of their key mandates as professionals, of course, is to ensure that they do carry out health education, as well as doing as part of their routine. They pass the messages that from the national bodies to all the way to the city level, and they are very trusted as advocates for health messaging. Next. So one of the things that we talked about during that training, we focused on how to communicate the different sources. And looking at Nairobi that time, the city, of course, the major sources of pollution were transportation, waste burning, as well as industry. Next. Another area. Next. We also just communicate on some of the strategies, communicated some of the strategies that they need to employ when they come to talking to the city residents. Basically, like things like being aware of some of the sources of air pollution in the different environments, different settings at different times of the year, whenever there are sudden changes in the air quality. So what they need to do, just trying to prepare the community to know what is expected of them. For instance, when there is a lot of traffic, they should avoid like outdoor activities like exercise. Of course, they're avoidable activities. So these are some of the messaging that we were able to give to the public health practitioners. Next. Next. So of course, in addition to that, we also told them to just focus especially on the critical times. because communication is key. The timing also very important, especially for health messaging. For instance, whenever they are doing their house visitations, home visitation, they could pass on the message during emergency situations. Of course, that time, everybody's keen to hear from the authorities. And of course, during their routine works, these are some of the critical times that they need to carry out some of this messaging. Next, please. So that is for Nairobi. So I just want to share, apart from the works that we are doing in Nairobi, we also have other works in other parts of the world. That is, I'll share the experiences from India and Jakarta. So for India, we have this playbook, which is an accredited, for accredited social health activists in India. This is a very simplified book with the materials to build capacity among the accredited social health activists, just to integrating key messages on promoting clean air for health. And basically the book is available in Hindi and English. Next, please. English. Next. So basically, it just gives them the ushers main advice on how to advise the community during poor or severe air quality days. For instance, things like whenever they are experiencing any symptoms, what they should do, what they should consult a physician at that particular time, what to look for, what are the maybe in terms of what they could do, like wearing a mask if they have to go outside, outdoor at any point. And also just trying to advise, especially the vulnerable population in terms of what they should avoid, because they are people who are prone to specific risks when it comes to air pollution. Next. So in Jakarta, we've also done some studies, as one of our areas is also ensuring that we, in terms of research and evidence-based, policy, advising the government coming up with policies that are evidence-based. So in Jakarta, there is this study just looking at the impacts of air pollution on health and the cost of illness in Jakarta. And this study was done by our team. And first it looked at the health impacts of air pollution with over 7,000, health outcomes in children and over 10,000 deaths attributed to air pollution each year in Jakarta. And as well, it looked at the economic impact, and it established that basically a total of over 3 billion, close to 3 billion USDs are actually lost due to health pollution impacts. So this is a major, some of the work that we are doing just to show the government to come up with policies. And next. And we also partnered with the BBC as Vital Strategies with BBC Storyworks in this partnership program, focusing on 3 areas, just in terms of raising awareness on the various ways in which climate change is impacting on human lives, as well as trying to deepen the understanding of ways in which the community can actually be part of the solution. Then also just trying to mobilize future climate and health leaders and youth, basically trying to change their perceptions of communities, especially the marginalized, focusing on the marginalized. And actually we have this video. I hope I'll have time to, if we have, maybe it's a 5 minutes, so if we have time, I'll be able to play that. So some of what we've seen out of this is, of course, with the BBC coverage, we've been able to reach a very wide audience. And again, we've also been able to inspire solutions that protect human health, especially when it comes to combating the climate crisis in the globe. So next. So this is it's a 5-minute video, and actually it should be my second last slide. I don't know whether we have time, Victor. If we have, then you can play the video just for 5 minutes. On the link. Okay, so are you able to play the video?
No, I think we can share the link in the chat and folks
Perfect.
can have a look. Yeah.
Perfect. So that is, I think you can go to the next slide. Thank you. So I think Victor will share the link for the video so you can have a look at it in terms of what was done in Jakarta. So lastly, I just want to talk about some of the opportunities that we've seen in terms of communication in our experience in East Africa, that is in Nairobi, as well as other cities across the world. So we saw there's a lot of opportunity in terms of capacity building for the frontline workers because they are the gatekeepers. Basically, they're the ones who first come into contact with the patients and they give guidance. Then advocacy and community engagement, because they need to own up all the decisions that are made so that it doesn't just end among the professionals, because there is a lot which is in the professionals, but if it doesn't, we don't package that in a simpler way and push it all the way to the community, then we lose out. Then media engagement, the media, you can go back to our partnership with the BBC. They have a wide coverage, so supporting the media on how to report in terms of the health effects, it's very key. So that, because again, there are a lot of myths in terms of some of the air pollution, the effects about air pollution. Then, of course, technical guidelines development, and this is focusing on supporting just the government, because you realize air quality, there are no much guidelines. You rely on international and sometimes national guidelines. So locally customized guidelines to address local solutions. This is also very, very critical. Then last but not least, the private sector and the civil society engagement, because they play a very key role. There is a catchment they reach, there is a population they reach that all these other stakeholders might not be able to reach. So partnering and engaging these stakeholders is also very critical in the success, especially when it comes to communication about health effects. So I'll stop there in the interest of time. Thank you.
Thank you, Sami. Yeah, I think you've cast the net really wide in terms of engagement and engaging the different stakeholders. I also take note of a point that you made. In many instances, we focus a lot on, mortality in terms of air pollution being attributable to deaths. There is also a morbidity aspect to it. People have to live with asthmas and other diseases for many, many years, and which, has a toll on productivity as well. So communicating both sides of the story, I think, is critical. At this stage, before we progress, I would like to check with Tibebu and Seneca if there are any burning questions in the chat or in the Q&A.
There was just one question from Enoch in the Q&A, but I've addressed that already about volunteer work at C40. Otherwise, there's no other questions in the chat at this stage.
Okay, sounds good. So please, folks, don't be shy. We are here to sort of have a conversation. So feel free to pop in your questions. That being said, I think we can move on to our next presenter. So her name is Temitayo Ajilore. She is a scientific officer in the Climate Change and Environmental Planning Department at the Lagos State Ministry of Environment and Water Resources. She's currently serving as the City Secondary Thematic Network Officer for Air Quality and on C40's Air Quality Network. She's a member of the Climate Change Secretariat in the Climate Governance Structure, and is also a member of the organizing committee of the annual Lagos State Climate Change Summit. So welcome, Temitayo. I think we'll also need to share your presentation. So just 1 second as I do that.
Okay. All right, Victor, are we ready?
Yes, let me just share.
All right, good afternoon, everyone. I'm Timitayo Ajilore. I'll be presenting on the successes and challenges in communicating air pollution and health information in Lagos. I have with me my colleague, Omomomi Omoshendemi, and you can feel free to ask any questions which you'll be ready to take at the end of the presentation. Thank you very much. So would I be into slide? Yeah, Lagos, as you can see, is the economic center and is one of the fastest growing megacities in Nigeria, in Lagos, in the world, and is a commercial and economic hub of Nigeria with estimated population of over 2 million people. So the city contributes to 25% of national gross domestic product, resulting in high rate of urbanization, industrialization, economic development, and these activities will definitely give a rise in the pollutant emission in the state. So the slide right beside the city information is talking about the emissions in tons per carbon dioxide equivalent. In 2015, the city carried out an emission inventory, which gave us a serious rise in the different sectors of the economy that gave us in transportation, energy, and also waste. So we were able to carry out this emissions inventory, and then we found out that transportation sector gave the most emission, followed by the waste sector, and then followed by the energy sector. The next slide, please. So this now brought us into understanding why there are so many mortality rates and so many sicknesses due to the ambient air pollution in the state. So Lagos air pollution is about 6 to 10 times higher than the World Health Organization recommendation level. And then the concentration is very similar to those of cities like Beijing, Cairo, and Mumbai. So in 2018 also, a study was carried out in Lagos, which was talking about the cost of air pollution by the World Bank. And we were able to depict from that the document that the air pollution led to about 11,200 premature deaths, and which is the highest recorded in West Africa. So next slide, please. So this now led us into carrying another emissions inventory in the year 2019, where we're able to compare the results, the data that we're able to gather from this emission inventory. As you can see, the stationary energy for 2015 reduced at least by 2% in year 2019. In the transport sector, it also reduced by 2% in 2019. And then in 2019 also, the waste increased. It increased by 4%, which this webinar today is tailored towards the challenges the state is encountering in the waste sector. Please, the next slide. So this is the waste outlook in Lagos. Presently, the state currently generates over 13,000 tons per day of municipal solid waste, out of which 50% of it collected are received across 4 dump sites in Lagos, and then some from the existing power plant industries, from locations in the state, due to several factors, which includes the population growth of the state, the urbanization, industrialization, and economic development. A study was carried out lately, the gaps and needs assessment for waste priority, high impact in Lagos. In that document, we're able to depict the rate at which the wastes are not being sorted from the source, even at the point of collection. So that is also a very huge challenge for the state. which is resulting into primary cause of blocked drainage channels, and it is one of the impacts which the state is facing. And we are currently experiencing flooding, especially anytime it rains heavily, and it is on a very high side for the state government. Has been spending a lot of money on this, and we hope that with all these actions that you'll be listening to, that I'll be itemizing in my next slide, you would understand why the state government have been putting so much effort into the waste sector. Now, I'm coming into the challenges we've been encountering as per communication. Now, the communication challenges we've been having now, especially in this aspect of waste and every other aspect in Lagos state government, is that we have limited funding for advocacy. Now, limited funding for advocacy, you know, they are usually budgets that we've been allocated to each sector to carry out a particular job or one thing or the other. So in this particular sense now, whenever you go out to perhaps do a sensitization program, or perhaps you're going out for a rally or an advocacy program or something, you know, the budget that is being given is not usually enough for us to carry out all these strategies that has been laid. Then the next one is simplifying scientific terms in local languages. In Lagos, in Nigeria, you know, we have about three major ethnic groups, which is the Yoruba, the Hausa, and the Igbo. So in Lagos, you know, we have a lot of people from different ethnic groups, which will come and, you know, find their own greener pasture. So in trying to explain the basis as a scientific officer, you know, you always want to carry out and explain to them, oh, this is the PM 2.5, is the very small, tiny particle that enters into your bloodstream, this, that. They might not really understand those scientific terms until you break it down to them, and then you have to come to their own level of understanding those scientific terms to explain onto them. So it is usually very difficult to explain all these scientific terms to them. Then language barrier is also one of the problems, the challenges which we are facing in the state, especially when you go out and you go for advocacy or sensitization programs in the rural area where you have people of the indigenous citizens of the states, where you want to, you know, explain about air pollution from burning of waste, from doing a lot of burning, and you just want to explain to them why they shouldn't do this or that. It is usually a problem to explain to them, you know, especially when the officer in charge does not understand their language. So it is usually a very big problem. And then communication vehicles. Now, the channels at which we want to communicate, not all the public can use an Android phone or an iOS phone, where, you know, you want to go to flip through your WhatsApp, or you want to flip through the Instagram page or something. So, you know, we have to go through the people that we are communicating to. We have to understand the channel at which their communication can reach them. So it's usually something that we have to also look at before we communicate. And then lack of public volunteers. Now, in this space, is a very serious problem for Lagos state government. Why? Because a lot of people don't want to volunteer themselves as a waste advocate, someone that wants to stand in to speak, that will be a middleman in between the government and the people, that will be able to speak on behalf of the government to the people. There is nobody trying to volunteer themselves for anything like that. So, you know, it's usually it has to be someone from the state government to reach out to the people themselves. And that's also one of the challenges we have. So now the last one, which is the variability of public perception. Everybody has their own beliefs and they have their own way of thinking, and they perceive information. So, when you go out and explain to people and you explain to the public and tell them, oh, waste and burning, that you're burning your plastics, it is harmful to your health, it is harmful to your body, and you explain and you let them know, the way a lot of them perceive it. Even at times, a lot of officers, government officials have been attacked due to, trying to advocate and reaching out to them just to carry out this communication about the health and impact effect of burning of waste and all this to them. So that brings us to our success story. Next slide, please. So yeah, these are communication strategy, which is the way we've been able to succeed in communicating to the public. The major one is the public awareness. We're able to carry out a lot of public awareness campaigns through holding stakeholder engagement, hosting several community cleanups, especially at the beachfront, at the waterfront. We carry out a lot of advocacies, using the mass media, through the social media, the local TV and the local radio. We've been able to carry out a lot of campaigns and to publicize why you shouldn't burn your waste, why your waste should be sorted from source, why your waste could be your plastic waste could be recycled into something worthwhile. So that is one of the reasons why we do a lot of public campaigns. Lagos State is good at doing a lot of public campaigns about air quality. So the other ones we do is that we influence the influence of public health leaders. Now, for instance, in Lagos now, this Ministry of Environment and Water Resources, we have the health officers who are also working in between the health sector and the environment sector, and they stand as champions that will be able to go into the rural areas and the local government areas and then speak one-on-one with the people, meet with them, advocate, sensitize them. And then, it's a very good thing that so many engagements has happened. And then we've been able to, bring up little heads in those local areas where we can, always liaise with them and they liaise back to the state government. And that's what communication is all about, when you're able to pass an information and then you receive back. So that is one of the good things about our communication strategy in Lagos State. And one other beautiful thing that we've done in Lagos is that in communicating about these waste problems, we're able to do a lot of recycling. Now, sensitization programs, campaigns have happened that the state government was able to reach out to a lot of communities, and the rural communities, the coastal, the water bodies, we're able to reach out to them. And then we carried out this collection of plastics for recycling, whereby they get incentives for exchanging their plastic. So, a lot of these local people in the rural community, they want to do more. Even in the city, a lot of people want to pick up their plastic. They want to quickly pick it up before another person comes in order to, recycle and get an incentive for picking. So those are one of the areas that we've been able to succeed in our communication strategy in waste and the waste sector. Thank you, Victor. Can we go to the next slide, please? The next slide. So our success story. Sorry, before you move, can you go back to the slide? So as you can see this picture, if you look at it very well, you notice that some of the materials used in this picture are from waste. There is this Malta Guinness can that you can see here is one of our the strategies that has been put in place for the waste sector to pick up waste from the source, to sort it from the source, and then transform it into something meaningful. Thank you. Next slide, please. Okay, yeah, these are our success story. like in the community now, this is one of our the community recycling bank that was where we attended to that we went for sensitization, and then this is a bank where we collect plastics from the community, and then you get an incentive for bringing in the plastic. So the more the plastics you bring, the bigger your incentive is. So then you can also see on the right-hand side, of this slide, that there's a sensitization of informal recyclers here. So we have informal recyclers where they collect plastics also, and then they transform them into bags, they transform them into fabrics, they transform them into mats. These are the local recyclers where, you know, they are able to transform their works and using plastics, and it is a good thing that it is reducing the waste in Lagos State, and also is cutting down emission in the waste sector. So we are hoping that the emission inventory that is ongoing right now would also bring down the emission rate in the waste sector. Thank you. Next slide. Okay, so the boat you can see on this left-hand side of the slide is a kind of exercise in the public, that we have on the beachfront, on the lagoon, the rivers, the streams. So we're able to, you know, get some boats where we're able to collect dirt on the water bodies, we're able to collect waste with water body, and then they get sorted. Whichever one is useful, they sort it out, and, you know, they carry to the recycling point, where on the right-hand side you can see the partnerships. So the state government has been partnering with several private sectors on recycling initiatives. A lot of them are the development partners. So many of them are partnering with us on waste wealth, on so many beautiful outcomes from their partnerships. So this is one thing where they are able to provide back to the locals to collect their waste. The next slide, please. So we have come to the end of this slide. Thank you very much for your time, and I hope you enjoyed the presentation. Thank you so much.
Thank you, Temitayo. That was a nice presentation. I took note of something you said. Communication is two ways. So it's not just the experts breaking down the science. We would need to listen to the communities and their needs and their experiences, and factor that into our own sort of research and understanding. And I think it's critical that, you know, Lagos State has picked a sector that's very visible, which is waste. It's a big problem in many African cities. So thank you for that. Do stick around for questions. I think I'm beginning to see questions streaming in the Q&A, and Omowumi as well.
Okay, thank you.
So thanks. So let's move on to our last presenter of the day before we can engage and discuss more on this topic. So Jacqueline Lidubui comes with a very long CV, so I'll read part of it. She's a multi-award winning communications professional with a long career in journalism, media training and management across public and NGO sectors spanning over 20 years. She's working currently as a program coordinator for Clinical Catalyst in Nairobi for Internews Earth Journalism Network. She's previously led projects on inclusive media at Internews as well. She's, you know, has worked across many media houses and has a couple of awards, including the Disability Mainstreaming Award in 2017, the Annual Disability Rights and Advocacy Award as a media activist for persons with disabilities in 2014, among others. She is currently pursuing a PhD and is in the process of submitting as a dissertation, but she holds a master's in arts degree in communication studies from the University of Nairobi and a Bachelor of Arts degree in communication studies from St. Paul's University. She's very passionate about social justice and has published widely on the topic. and she's recently been working on air pollution, and we are happy to have her. So over to you, Jackie.
Thank you so much, Sami. Being a last presenter, I think now you know I'm in the same room with Sami. That's what I'm saying, Sami. So thank you so much, Victor. Being the last presenter, I think it is very tricky because everyone has said everything, so you don't know what to say. But I'm going to try and say something about engaging with the media on air pollution and health, what scientists must know. And I'll use the case studies we've been doing in Kenya with Internews Network. Internews is an international organization whereby we train journalists on how to report underreported issues in Africa, air pollution being one of them, disability, coronavirus. We used to do a lot of HIV and also maternal health. So I'll start. So I can't be able to move my slide.
Do you have it on full slideshow mode?
Or maybe I'm sharing my screen. So I'll share again and try to move it.
Okay.
I need to put it in slideshow mode, right?
Yeah, I think that will be easier for you to move. Yeah.
Okay, so media can shape perceptions, inform and influence policy on air pollution. So that's why we really talk about media and empowering the media personnel on how to report on underreported issues. Because at Internews, we believe in the bottom-up approach. In the bottom-up approach, we believe that the media works in the community. So if we empower the media to understand air pollution, the media can therefore talk to the community in the way that the community would understand. So, but for air pollution and some of the...
Sorry, Jackie, before we proceed, we can't see the screen if you're sharing.
Oh, you can't see the screen?
No.
Mm-hmm. Right now, can you be able to see it?
Yes, we see it. So if you do slideshow.
Okay.
Perfect.
Is that better?
Perfect.
Yeah.
Yes.
So yeah, so for me, most of media houses, they depend on business models like advertising so that they can be able to get money. But you find out like they don't favor topics like air pollution, environmental topics, or maybe disability. So they won't really concentrate on talking to the publics about these important issues. That's how we come in, and then we sponsor media houses by maybe giving them grants, training journalists so that they can be able to communicate these important issues to their society. So air quality complexities pose challenges for environmental journalists because of most of them, they don't learn about air quality or environmental journalism when they are still in college. So when they come to the field, they also are somehow challenged about these issues. So when we started this project, we are working in 3 countries, Jakarta, India, and 3 cities, Jakarta, Indore, and Nairobi. So in Nairobi, we did a media scan, and we find out that there's few stories about air pollution in Kenya, and journalists in Kenya face a lot of challenges. They have knowledge gap, they have resource constraints, which makes them to have a barrier in reporting air pollution. Also, they say that there's difficulties at accessing air pollution information because they don't have linkages with the scientists or the people who are concerned in the field. There's also safety concerns. Some of the areas that are polluted so much in Kenya, you can't easily access them because there are cartels who are there. And also there's also potential government retaliation because the government would think you are exposing them, but you are just trying to do your work as a journalist. Also, there is also restricted access to pollution hotspots, like the biggest dump site in Kenya, Dandora, where there's a lot of air pollution, but accessing that place as a journalist is like, you won't really be able to access that. And also denial of crucial air quality data by organization, because also the organization don't trust the journalists. They don't know what the journalists are going to do with that data. So they don't really release the data on time. And then the way I had mentioned, limited media budgets for air pollution stories. Media favor story, entertainment, politics, news, things that will bring them quick money and also a lot of viewership. So those are some of the barriers that journalists in Kenya say that they are encountering. And then, so as Internews, we organized a media training workshop to strengthen this knowledge and skills on air pollution, and also to empower journalists with tools for gender-sensitive reporting. And then we had expert sessions, because some of the challenges were that journalists, they don't have experts who they can be able to link with. So we made sure we have all the experts in the air pollution field, from health experts, Dr. Simeyu, to experts in the academia, like Dr. Njogu, I think I've seen him on this call, to people in the county government, to the universities, to the people who are in charge of census, so that they can be able to engage with them. We also had a field trip, and that was an eye-opening 3-day session with the journalists. So one of the field trips, we went to City Cabanas. That is one of the most polluted places, bus terminus in Nairobi, whereby there's motor emission combined with smoke from cooking stoves, because there are vehicles there. Also, there are women who are cooking on the road. So there's a lot of combination of pollution there. And then we also visited the University of Nairobi, so that the journalists can be able to know, to be introduced on air quality sensors and monitoring. And it was an eye-opening even to some of us, like me. I didn't know, like, we monitor air in Nairobi and we have sensors everywhere. So as trainers, we also learn on the field, so that we can also be able to train well and also expose our journalists. So this was the format of our training, and it was very successful, because after the 3-day training, the journalists were saying they didn't know about PM 2.5. That was the first time some of the journalists were hearing about that, and some of them said that when they heard about air pollution, they just know it's carbon dioxide. They don't know anything about PM 2.5, methane, or any other pollutant. And then there's also this journalist who said he works in a radio station near Cabanas, where we visited the bus station. And he said that day he was looking at Cabanas on a very different angle, because he'd been passing there, but he didn't see like the impact of air pollution. So the workshop guided journalists in developing impactful story ideas, and even to broaden their perspective on story production. So there were many stories that were produced. So for the training, we held it in early May. So far, we have around 60 stories which have been produced on air pollution from 2 stories. When we did the survey, we only had 2 stories which have been done on air pollution, and those stories were just on Clean Air Day, I think, just reporting on an event. But right now we have journalists who we've trained, who are delving deeper into matters air pollution, talking about sensors, talking to specialists in Nairobi who are very available and ready to give them information, and also talking to the communities, like the mechanics who deal with the catalytic converters, because in Nairobi is black gold. Most of the mechanics remove this thing and they sell. So we have produced indeed very eye-opening stories, which have even made the discussions around many WhatsApp groups and in very many media groups, and even around, because people really didn't know about this stuff. So, and even during the climate week, we also did a very big story on the green city in a fatal fog. And it also made a lot of rounds because it was published in the continent, which is one of the largest media house in Africa, because they use WhatsApp. So you will find all their publication in maybe all the major WhatsApp groups for journalists in Africa. So that was just one way of showing that when we empower journalists, they can now be able to know what they are supposed to do, and then they can be able to communicate to the publics. And then apart from that, we also I was wanted to talk about communicating with the communicators. So like now we have taught journalists on how to communicate about air pollution. What about the scientists? What about all of us who are in this group, who are scientists, researchers, academicians who deal in air pollution? What else can we do? So this was just a challenge, because I think the last webinar I presented, I need to know how to communicate this to the public. So I had just a few guidelines, which we can talk about them quickly. So the first is some numbers. So there was a survey which was done in the US, and it said that only 47% of people with high science knowledge believe that research scientists are good communicators. Then at the same time, the same survey reveals that 62% of people believe scientists are good communicators. However, these are people who have very low knowledge of science. So there is this, and that's a challenge to all of us, because we are coming up with data, we are coming up with very good things, very good research, but do we know how we can be able to communicate it well to the public? So the first thing is we need to understand our target audience. So you need to know, you identify the target audience of the media outlet and tailor your message accordingly. Consider using language that is accessible to a general knowledge. So if you are talking to a community radio station, if you are scientists from that community, if you can talk in that language, the better. If you are in town, the youth, many of them, or the people in the informal settlement would like to speak in slang so that they can be able to understand you well. It is good for you to talk in slang or in a manner that it is understandable. And then some of you will ask, how do I talk a whole scientific word in slang language? So let's see. So know your key messages. So crunch your research findings into a few key messages, and you clearly articulate the main points you want to convey. So it's not just like numbers, datas. So your key messages, and what do you really want to communicate? So if there's high pollution in Nairobi, it causes some of the diseases, it causes stunted growth, it causes lung cancer and what have you. So you communicate in a way that the person you are communicating to can relate on how this data is going to help them. Also, like, we avoid jargon, minimize the use of technical jargon. If you must use specialized terms, be sure to explain them in simple and understandable language. You can say PM 2.5, but be able to tell someone these are very small particulate matters. We cannot even be able to see them, but they're in the air. When we breathe, it goes to the lungs, and when it goes to the lungs, some of them are poisonous. It will poison our lungs, and then maybe we can get cancer, and then we can get lung diseases, so and so. So you simplify. So when you talk about PM 2.5, PM 2.10, someone will be able to know what is the effect of this. So don't just talk about it, and then you cannot be able to relate to the person you are talking to. So when you've been invited to a media interview, be able to relate. Just say a simple story that someone can be able to relate to, and then use analogies. So analogies can simplify complex concepts. Relate your research to everyday experiences or phenomenon to make it more accessible. So you tell people, like, even when we have sensors, when we measure this air and then it is very polluted. So it is very important for you to be able to know, don't visit this place if you are suffering from maybe asthma, or if you are pregnant. You can choose a day when it is not very polluted. That's why this data is very important for you, to guide you on how you can even make your movements every day. And then stay calm and collected. If faced with a challenging question or a situation, just stay calm and composed. It is okay to take a moment to gather your thoughts before responding. So don't just respond, don't panic, don't fear media, don't fear interviews, because most of the challenges the media people tell us, they don't want to appear in our shows. They are not ready, because maybe so many of them will think we are ambushing them, but we are trying to create a very conducive working relationship between the scientists and the media, so that all of them can work for the better of the society. And then at the end of it, anticipate questions. So think about the potential question you might be asked and prepare thoughtful and concise responses. Consider positive and challenging questions. Don't be shy to answer the way you understand it. There's no one who is holding a gun on your head. So just go ahead and have fun and enjoy, so that people will say scientists are not very rigid, very serious people. They are people who can joke and have fun. So that was what I just wanted to present shortly on the work we've done with journalists, and also how we can help our scientists and people in the air pollution to be able to be free with the media and to share whatever knowledge is out there. So thank you so much.
Thank you, Jackie. And we can see why you're a good communicator. I think you threw the challenge there. Sometimes it's hard to stay calm and collected. You may feel like a journalist is attacking your intellect or something. But thank you for that. I think we have used our time very well, and now we would like to open it up for discussion, questions from the audience. And thank you to our speakers for really taking time to go through the various aspects of the question at hand. So I would like to start with one that's in the Q&A that cuts across various things that we've actually talked about throughout the series. And that's from Melissa Kwenku from Douala, Cameroon. And she works as a communication and PR officer of an association called Environmental and Lung Health Association. So she's saying they actually went ahead and procured sensors and started monitoring in Douala. And they've collected this data for some time. For the last 3 months, in the last 3 months, that is, they've started sharing this data publicly on Facebook, I think is, the Facebook platform. And each quarter they have, posts on Facebook saying, this is at the levels of PM 2.5, et cetera, et cetera. So she's eager to know what else they can do with this data. How else they can sensitize the masses with this content, and how any of us can help. So I will throw this to our speakers in any order, but maybe the C40 team, if you have any insights on this, then we can go to Sami, then Temitayo, and Jackie, if she has anything to add. Anyone from C40 who would like to respond or share any insights?
Yeah, sure. I can maybe come in, and I can maybe then hand over to Victor, Tebebo, or Simon. So I think that's a really great question. And I think, Victor presented a little bit about what we did at our communications workshop. And one of the major themes was translating data to communications, and how we actually go about doing that, and making it easy to understand for people. Of course, if you're communicating over a platform like Facebook, you wanna try and keep the information as simple as possible, so that it sort of resonates with your everyday person, resident to people that are either working in the industry or, you know, research space or whatever the case may be. So it is very good to have that data to back up and have the sort of firm evidence base that you need for communicating that information. So it's good to have that and use that data, whether it's annual averages or any sort of analyses and trends that you find within that data, and translate that into information that is easily understandable. So maybe one thing I can just say that, especially on a platform like Facebook, that might be quite relatable is something like infographics. I think infographics it's a great way in translating data. So, you know, in the form of pie charts or graphs, something that's very eye-catching. And that's a great way to sort of translate any information that's data heavy into something that somebody can just have a look at and say, oh, okay, you know, I can see that PM 2.5 levels from the transport sector is really high, or vehicles is really high. So, you know, we need to look out for ways in which we can curb that. So maybe just one piece of input from my side. I think infographics on a platform like Facebook, I think could be really, really useful in translating that that data heavy information into something that's a little bit more relatable. Tabebu, Simon, Victor, anything else from your side?
Yes, thank you, Seneca. Thank you, Victor. And yes, I just want to add a little bit some aspect of equity when you need to communicate the data you have monitored. I think it's important to take into account or the various aspect of the channels to reach out to the communities. I think Facebook is not enough because it just takes part of the segment of the community. So you need to diversify the channels using like Facebook, radios, TV, especially during the peaks of air pollution in Douala. You going forward, when you monitor 1 year, 2 years, those statistics should help you to identify the main season during which you have the high levels of air pollution in the city, and then you can anticipate using different channels to reach out to the communities and communicate, anticipate in order to avoid the people who are the most vulnerable to air pollution, like asthmatic people. Yeah, to communicate using different channels. Like, thank you.
Yeah, I just wanted to add one slight thing there. So there are two things there. There's two ways. You can communicate the data as is. And I think to do so, probably you need to talk to other players who could help you with what Seneca called graphics and all that, so that at least that data is in a form that can be consumed. And I see Echo on the call, probably they could be people you could start talking to see how you can share or maybe that information publicly. But there's that other aspect of transforming that data into something useful, maybe for health, maybe for transport, or maybe even for economy. And that's why you need another layer of an expert to transform that data to information that could be communicated to those other sectors. So you can communicate that as it is, but also transform it into useful information. And yeah, in both cases, the channels will be varied, and yeah, it depends with what you have at your disposal. Thank you.
Thanks. Yeah, I think so. We've usability, equity, and other aspects. Tibebu, please go ahead.
Yeah, to add point on some of the already information given by my colleagues, just as Victor and Dasi presented, formally that we are actually helping C40 City in undertaking different analysis, like using Benmap and Aquatool. And C40 analytical team actually come up with a good tool called the Aquatool, which actually you can perform easily some of the PM 2.5 impact in terms of the health and the economic impact. Maybe it is good to go through some of the manuals that we have and openly accessible in our website, like Aquatool, so that you can change the PM 2.5 you collected for the last 3 years or 3-month or annual base. So if you can transform them into health impact and economic impact, so that people can understand the impact of the PM 2.5. Thank you.
Thanks, Tibebo. Sami, any insights on the health side and how we would communicate PM 2.5 data?
Yeah, thank you so much. I think my earlier speakers have already addressed part of what I wanted to raise. However, just to add, I think going by the experience in Nairobi, what we learned that the best way to share, to communicate whichever data that you have is actually building coalitions and bringing on board all the stakeholders, because we realize that perhaps even all that you could be having a lot of air quality data, but you might not even consume that data. You might not communicate that data. So you need to bring on board the key stakeholders, the media, the academia, the researchers, all these people who can break down this information in forums. So have dissemination forums that can enable you to share this information with the different stakeholders internally first or externally. So whoever feels that they can make a meaning out of that data, then they can put it out to use. Then another thing that I just want to highlight is when it comes to air quality data, because I think that is a place we are coming from as a city. Initially, we were saying there is no data, then we realized there is air quality data, but what do you do with the data? What next? The data is out there, but what do you do with the air quality data? So for as long as you're not linking it, we came to learn that for you to make a meaningful, like to communicate back to the key stakeholders who are the general public, you have to link this data to air quality data, or to especially like air quality data and the health data, for instance. So you cannot do this alone. You might not communicate this alone. You have to bring the health experts on board so that they translate, they look at the air quality data, you look at the health data, then that way you are able to communicate and influence policy. So I think that is what my contribution will be. Thank you.
Thank you. Temitayo, you're also at the front as a city. Any thoughts? Temitayo, is she still with us?
Yeah, sorry,
okay.
Victor. Yeah, I'm with you. Yeah, just like the speaker just now said, it is in Lagos. The city has deployed several sensors to capture these pollutants in strategic places and locations within the city. So, and with the help of air quality, C40 Cities, we've been able to deploy more sensors to the city to carry out more, to detect more pollutants in the city. Sorry, there's noise on my. So that's all. Thank you.
Thanks. Jackie, before we move on to a question, someone has raised their hand. Do you have any additions, Jackie?
Not much, but for Facebook, or if you're operating social media, what I would just want to encourage them to do is to do data visualization. It works very well. instead of just putting the statistics, do data visualization, and also to have a wide range of network. Please tag people in the space of air pollution, climate change, the government, the academia, people who have influence in that area so that they can also spread it wide and large. Thank you.
Thanks. Yeah, I mean, so for our audience, I mean, this session is for you, so don't feel shy to raise your hand or anything like that. I say Kasahun has raised their hand, but before we go to you, I'll go a bit off script and allow Deo to speak on the question at hand. As Victor Indasi mentioned, you know, ERCO is one of the institutions, as we all know, that's gathering a lot of this data, and they do have some interesting ways of sharing it. So Deo, I know this is off script, but I'll allow you to speak briefly on this.
I hope you can hear me.
Yes, we can.
Yeah. So yeah, like you said, nothing really prepared, but just to say that I think in terms of the data sharing, and maybe I'll speak to kind of like some of the interesting use cases. I do like that the experience of getting the data and share directly on social media, say like Facebook. I think that's very practical. But also one way of amplifying that, one thing you've seen is being able to appreciate the individual local context. So we have these digital platforms, but then the question we're asking ourselves, so what happens if, let's say, you're in a community that, say, for example, only speaks French? And also, how do you then approach? Because then we have all these things. You have, for example, this webinar in English. Like, I mean, does it not leave out many people? We're asking our colleagues in Cameroon to adjust and speak to us, but what if we had this in a way that they can actually be able to understand? So, one thing we've tried to do is now officially, for example, in the case of like the mobile app, now being able to support multiple languages. So whether it's Portuguese, French, and Swahili as well. And I'm still keen on exploring having it in Pidgin, so keep it kind of like real. So I think that aspect of packaging the data, something I see has a lot of potential to explore very deeply. The other thing, of course, is I think we need to look at journalists. The media community has like not just as consumers, I put that in a comment, but rather has strategic partners in a way that they also benefit beyond just saying I'm reporting on climate, on air quality, I'm reporting on this. But I think if, let's say, what if we had journalists whose identity is basically reporting on air quality, just like you've seen in politics and others? So how can as people work in the space to kind of like approach it in a way that it's really benefiting everybody in all aspects? Data sharing, yeah, I don't know if that speaks to the questions that were raised, but I think even in terms of data sharing, I think we have a default sort of like open access approach, but maybe we look at facilitating the sharing from a point of building data products that will facilitate ingestion rather than actual data, because not many people are going to be able to download all those rows of millions of rows of data, but rather can you develop data products from the data that we are generating so that that can be consumed by the right audiences. Let me stop there, and I hope I've been able to speak to some of the emerging questions.
Thanks, Dale. Always prepared, even when not prepared. So I see a question in the Q&A. I think we'll come back to that. I'll just take the two questions from colleagues who've raised their hands. That's Kasahun and Kellen. Please, we have about 15 minutes for this, so I'll ask that you be brief. And if you're addressing the question to one of the speakers, please let us know who. If it's a comment, that's still okay. So I think I'll start with Kasahun. I'll allow you to speak, then Kellen. Please go ahead, Kasahun.
Yeah. Hello, everybody. How are you? I'm from Addis Ababa University. Addis Ababa University is working jointly with C40 Tababu, and from National Meteorology Agency and different NGOs working in air quality. Actually, US partners such as Solomon is organizing a working group with us. These days, they are giving us a number of air measuring, air quality measuring, especially PM 2.5 measuring instruments. So we are scanning these instruments, calibrating against beta attenuation particulate matter measuring instrument, which is deployed at one of the hospitals, Black Line hospitals. So already we have also different sensors. Now these days we are this is but want to bring all the data on board. So at this stage, we are working on that just to have network of different data collected from the city. So I think proposals, seminars, and fundings as well. So far, that's at a starting stage. So I think in the near future, we'll deliver the data to anyone interested. So the network, this is the network establishing stage, the data collecting instruments, calibrating stage. So we are at this stage at the moment. Just to give you the update, what we are working.
Thanks, Kasahun. I think you're part of the many efforts that are underway in Addis to sort of establish air monitoring networks. But thank you for that.
Yes.
So, Kellen, over to you.
Thank you, Victor, and thanks everyone for the good conversation we've had. I just have a question, and actually not a question, a comment, and this goes to the Health Effects Institute. We've seen communications campaigns that have worked previously, but in the area of communicable diseases, that's HIV in particular, and some of you may resonate with It Begins With You. So can we as a team think about a low cost, or so to say, a cost-effective communication campaign that can speak to, you know, same message across, maybe we can pilot maybe 3-4 countries in Africa, and then later on countries can adopt, because that's what we did with that time when we're still working in HIV. We did, you know, same message, you know, standardized, simple, from primary one, somebody could tell what's HIV and how is it, you know, contracted and how can I avoid it in simple ways. And I think that this is the time when us, the folks in non-communicable, who are dealing with non-communicable diseases, it's a time for us to look at these risk factors like air pollution and have like a standard message. Because even when we are communicating PM 2.5, but what's the link between PM 2.5 and health? Because that's one big area, and economic development, for instance, and per capita income, for instance, and productivity, for instance, and all those. So we could choose like 3-4 areas, and then we say, can we develop simple standard messaging? And then we just put it in our different languages in Africa, and then we have it run. Like, I think Health Effects Institute can support this, and then we get it up and running. Thank you.
Yeah, thanks, Kellen, for having so much faith in us. I will just say I couldn't agree more. I think there are levers that you can pull in terms of, from a communication angle, in terms of getting the message across. It's very often a question of how and who do you address this to. I mean, if the example I use normally, if you take the Kenyan example, you look at our demographic and health survey and some of the statistics that are released by the Kenya Bureau of Statistics every year, you see respiratory illnesses going up and other NCDs actually going up every year. You know, the numbers are always going up and you begin asking yourself why. So, you know, there are those levers that we can pull. They are maybe different for different settings, even within the East African region in terms of what those health messages would be. But yeah, I do agree with you that, you know, that is something we can consider or should indeed consider. I don't know if there's anyone else on the panel who would like to weigh in on this before I go to the question in the Q&A.
Yeah, thank you, Victor. I think I can come in. Yeah, so thank you. I think that's a very, very brilliant kind of, that's the approach you need in terms of if you want to make strides in this area. So again, I mentioned just what I presented. One of the in one of the cities that is in Indo, we developed a playbook which is very simplified with very simple messages, non-technical, no jargons, very simplified, that can help to communicate key messages when it comes to air pollution, what to do, what are the signs, what to look for. So basically, I think that aligns to what the work that you've already done in other pilots. I think we could as well think of something like that in East Africa, and of course, with the leadership from HEI, I believe this is something that you can achieve. Thank you.
Thanks, Sami. So I will go back to the Q&A, and there's another very interesting question that I know is close to the hearts of many of us. So Sankaru Ture says, I think curriculum reform in high schools and higher education institutions are potential targets to improve air pollution literacy. In Gambia, we are looking to reach out to high schools, universities, so that learners in those institutions can be exposed to atmospheric chemistry, the impact of PM 2.5 as one of the five main risk factors for NCDs. Our education curriculum has not caught up with the science. I don't know if that's an observation or a question, but yeah, beginning early in terms of curriculum development and formation of kids, even before high school, maybe in primary school. Would anyone want to speak to this in the panel before I go to the audience? I know in the audience, there's a couple of people who may want to say something. So I'll begin with our panel. Anyone? No? Kellen, your hand is still up. Is that for this or something else? Please go ahead, Kellen.
Yeah, I think that's very pertinent as we move forward in the long run. We need to start to look at partnerships in communication, and the education sector becomes a key partner for us to talk to. And the way we can talk to them is to start with, you know, like, what do we do with the curriculum? Like health has done very great job around health and in integrating health in the education curriculum. We can ride on what the health sector has done, and we integrate a few, 2, 3, 4, 5 things in the curriculum, starting from primary to secondary, as we build, you know, the advocates of tomorrow, the experts of tomorrow, but also to create this kind of literacy that we need to see, so that we have at least a competent community, because that's what we need at the end of the day, to be able to adapt and mitigate. Yeah.
Thanks. Well said, well put. So I will call on a few folks also off script and not prepared. Professor Paul Njogu, you are at the university as a lecturer. You are also at the chair of the Data and Research Committee in Nairobi. Would you like to weigh in on this? in terms of education and learning, so that we have more people know about air pollution and atmospheric science. I've allowed you to speak. If you just need to unmute yourself. Okay. Maybe he's not ready. Kanyifa, would you like to say something here?
Thank you, Victor. I'm not in academia, but I agree with the sentiments about pushing the ministries of education to actually consider starting early, because most of us pick air quality or air pollution or atmospheric sciences much later in life, when you've not even built a good foundation. So yeah, I think maybe all the nationalities represented here could start the conversation with the ministries and see how far that goes. I know at the PHRC we had started that discussion with the team that looks at education, but I think it has not moved, because we've not really engaged quite a lot. So it could be some challenge to us to actually start the conversations and take advantage of all this climate change and health focus, and see how to embed air pollution into our education systems. I think it would be quite a great service to the continent if we do that. Thank you.
Thanks. Well said. I don't see any other questions in the Q&A. So I'll just take a final intervention from Sankaru. Then we can finish. We can close.
Hi, thank you so much for a very insightful presentation by the speakers. I think one of the challenges that we've had in Gambia is, the lack of data. So we're very early in deployment of our network, and we're trying to do things simultaneously to see about how do you start collecting the data, but at the same time, along the lines around communication, how do you go about translating that data that has an impact to individuals? So in Gambia, we have a Harmattan season, and we're seeing a signal that the air quality tends to be worse at that time of the year. But what do you tell somebody who sells in the market about what they can do to protect themselves? Do you ask them to wear a mask, or do you tell them, keep in mind that if you're more likely to have respiratory symptoms this time of the year? So making the connection between the data and actionable items in a language that people understand is very important. And I think that observation that we have to start early came from the fact that people don't understand atmospheric chemistry. So we have an integrated science curriculum in high schools. We learn about the water cycle. It's not a huge jump to teach people what PM 2.5 is and what that means, the impact of that on your health as well, as part of the One Health concept. So I think there's an opportunity there to integrate education, public health, and environmental health at the same time. And I think that's one of the things that we are looking to implement in the years to come. But thank you so much. I'm learning a lot from all of you across the continent, and it's a very wonderful talk.
Thank you, and thank you for that intervention. It's really nice to hear what's happening on that side of the world. Kellen, did you have something else to say? I see your hand is still raised. Oh, it's an old hand.
No, let me lower it. Sorry.
Okay, thanks. Yeah, Seneca, please go ahead. We are almost at time.
Sorry, Victor, there's one additional question in the chat box that was for Timoteo. She wasn't able to answer she wasn't able to respond to the question in the Q&A chat. So maybe we can just read it out, and if there is a bit of time, then she can just respond to it.
Please go ahead, yeah.
So it's from Paul Njogu. And Paul's asked if Timoteo can please shed some light on the most polluting sectors in Lagos. also highlighting how the emission inventories were developed. And yeah, if they can get in touch at a later stage. So Timothy, I don't know if you are able to maybe respond to Paul directly.
Thank you, Seneca. Yeah, I'll start by answering the question on the sector that pollutes more in Lagos. The sector with the highest emission in Lagos is the stationary energy, where we have in 2015, sorry, in 2015, we carried out an emission inventory, whereby the emission inventory gave us a data with 55% of emission, and in 2019 we had 53% of emission from that sector. And then the stationary energy, as you can see, due to the population in the states, a lot of people uses different forms of energy, whereby a great increase in the rate at which the emission from the energy sector has been very, very disturbing. And then we are hoping that by the end of the emission inventory that is ongoing right now, we are hoping that the stationary energy would come down much more with all the actions that has been put in place in that sector. So some of the strategies that have been put in place in order to bring down emission is by installing solar PV systems in schools, hospitals, and municipal buildings. We also reduce emission in residential sector by promoting the development of energy storage technologies, and then incentivizing the deployment of microgrids in off-grid urban communities. So, with all these put in place, we are hoping that these little actions will be able to bring down these emissions by the end of the emission inventory that is ongoing. Thank you.
Thank you very much. And with that, I think we are at time. So as we close, I would just like to thank C40 Cities, with whom we've co-hosted this webinar. So Victor Indasi, Seneca Naidu, Tibebu Asefa, and Simon Sambu, who are also really instrumental in putting together the agenda for this session. So thank you very much. This has been the third in a series of 4. So we close the year with this particular session, but at the beginning of next year, we'll have sometime in January, we don't have the date yet, we'll have our last in the series, where we'd be looking at opportunities for promoting integrated action. That's to do with climate change, energy, air pollution, the kind of priorities that we hear every day in our setting. And COP is just about to start as well. So yeah, that session will be quite interesting. So welcome to join us for that session. I would also like to thank the HEI staff who put this together in the background. Thank you very much for a smooth session, and we will also be making available the recordings for this session on our website in the coming days. So thank you very much. I also take this opportunity to wish you happy holidays in advance, as we will be seeing you again in January. So happy 2020, end of 2023 and beginning of 2024. And we look forward to seeing you in January. Thanks.